time for Dr. Joe. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, on board with the show, talking sports medicine. He's been doing it with us at this time for over 25 years. We appreciate the time and certainly the insight with Joe. Good morning, my friend. What do you have for us today?
Hey, Ray, I want to talk a little bit about, we talk about so many different things. I don't think we've talked about this form of technology. One of the really cool things about going into medicine is there's always new technology, and it comes at you fast and furious. There's always new things. And something that wasn't even on the drawing board when I started that 25 years or so ago, but has become a really important part of sports medicine that really helps us a lot in evaluating athletes, is something we haven't talked a lot about, is a tool that's been out there for a while called ultrasound. Ultrasound's been out there for a long, long time, but being used in sports medicine. And the usefulness of it really kind of increases every year. There's new ways that we figure out of how it can help us in evaluating athletes. And in general terms, by bouncing sound waves, it allows imaging. It can be portable, so you can carry it with you, or there's smaller units, or there's what's called point of service or point of care in places like emergency rooms. People use it. But in sports medicine, it's very useful. I believe we have 4 of them now on the books in 2024 of places that we can use ultrasound to help us diagnose. And the access is readily available. Instead of sending somebody, hey, in 10 days you can get an MRI or something, you can get that ultrasound that day. And many, many people in the field of primary care sports medicine, particularly the non-surgical part, are using ultrasound very readily to help us with making diagnoses. And it gives really good images, Ray, of tendons, dorsal sacs, ligaments, joints. Really, really good images. In fact, some people now feel that some of the imaging may even be better than the MRI, is what a lot of people say. But just a couple points about it. Number one, it started out as kind of a targeted steroid injection. We use steroid injections a lot, and instead of just blindly injecting the steroid into a joint or into a bursal sac, with the ultrasound, we can see exactly where we're going with that steroid. And steroid injections became a lot more effective when we were, targeting these injections. So that was a while back. And then we came up with something you and I have talked about a fair bit in the last 10 years, is regenerative medicines, like particularly PRP, platelet-rich plasma. We hear about it in sports all the time. And it is where we use a certain part of the blood that actually where the growth factors are. And it can actually lead to regeneration and actually healing of some of these injuries. And so it went not only from reducing pain and swelling like steroids to regenerating some of these tissues. And so that was really exciting. The third thing that's really exciting about ultrasound is it can be dynamic. So if you have somebody, for instance, with, say, an elbow injury or a finger injury, foot, and we want to see the joint move to see, did they tear the joint? Is it torn? Is it stretched? You can actually move the joint while you're evaluating them on the ultrasound unit, and that's what's called dynamic imaging. And that is very, very helpful to us and very, very cool technology that came about several years, 5-10 years ago. We've been using that. It's also very affordable. In some ways, again, better images than MRI and pretty affordable, too, that people use it right, again, at the point of service. There's no radiation to it like X-ray, so that part is really good. One thing I've seen very occasionally is on the field it can be used. We sometimes have a hard time evaluating what's called blunt abdominal trauma. Could somebody have a spleen injury or a liver injury? And I've seen people that are really good and very skilled at doing a lot of ultrasound, being able to get information about blunt trauma to the abdomen. So those are just a few of the ways that we use this technique called ultrasound. It's been very, very helpful. Nowadays in sports medicine, you really basically have to be trained in it. All of our fellows are trained very well. Dr. Derek Eddy he's been doing it for years for us, but our whole team does some degree of ultrasound, most of our team. And the confidence level, the more you do, the more confident you are. And so Dr. Eddie is so good with ultrasound. So we'll ask him, hey, take a look at this kid for me. Tell me what you think of this kid and so forth. And we learn so much information in diagnosing kids. So it's an important part of training fellows. And I did want to point out, tonight is our graduation for our 2 fellows who train in sports medicine. This is our 34th class. So we've really been blessed to have 34 years since 1990 of people training in sports medicine at Akron Children's Sports Medicine Center. And so all those people that are trained very well in ultrasound. And I wanted your audience to know how important and useful this tool called ultrasound is in helping us make diagnoses and do a better job in treating people in primary care sports medicine.
Excellent stuff. Joe, can the ultrasound imaging, can you do that on any place on the body? Is that available to get a diagnosis anywhere?
It's useful at pretty much any place around the body. It is particularly, again, in some of the soft tissue areas, tendon, bursa, ligaments, joints, really good in any of those areas, Ray, and throughout the body. And you know that other specialties, like in the emergency room, they use these very readily. My son's an emergency room doctor. They are all trained in ultrasound because very quickly it can help you get an answer in an area where, hey, it's important to get quick answers in emergency rooms. Important for us in sports medicine, too. So throughout the body, like you say, Ray, very, very helpful technique. And I really wanted to bring it to the fore for your audience this morning.
Great stuff, Joe. As always, good insight into the world of sports medicine. Thanks, Joe. We'll talk to you again next week.